observations. And I want to tell you a little bit more about observations. And I'm going to continue the idea of how to clinically observe, because this is such an important topic about how to observe the child and prescribe. Yes, you have to take the history. Yes, you have to go in detail. But also there is another point of view, and that is how to observe and prescribe. And that's what I want to share with you, because this is the real clinical data that I want to share with you, plain general. Mouth and teeth. Some children have a more premature caries of the teeth. Premature, the teeth get affected. The creosote children, the staphysagria children, the syphilinum children, the teeth are getting carried very fast. Some children, they get tartar, lot of black spots on the teeth. Some children develop what we call as plaques and tartar, and they meet a dentist, and the dentist look at the teeth and they do the drilling, and again they call after 1 month, and this goes on, and the dentist keeps meeting the children again and again and again. What can the homeopath do? 3 important remedies, ladies and gentlemen, for tartar, constant tartar in children. Number 1 remedy, remember, basilinum. Number 1 remedy, basilinum. I repeat, basilinum. Okay, big remedy for tartar in the teeth. Let me show you. Very important for tartar in the teeth, especially with history of ringworm in the family. Especially with, you can see here very nicely written on the last line, favors falling off of tartar of the teeth. Basilinum, very important. Basilinum, and I'm going to teach you basilinum a little later. Basilinum are one of the most restless children in homeopathy. Basilinum children can look like tuberculinum, but they are much more chillier than tuberculinum. Which is the other remedy for tartar of the teeth I'm going to share with you. Is a remedy which I use a lot as well. Let me show you. It is calculi renalis. So this is a remedy which is prepared from the renal calculi, ladies and gentlemen. It's a remedy prepared from renal calculi. And I generally use this remedy when I see a case of not just a child, but even of an adult who gets a recurrent renal calculi. If there is a recurrent renal calculi, then one of the most important remedy is a remedy which is prepared from renal calculi, and that is calculus renalis. I generally use it in 30 potency. And this remedy, and because it reduces the tendency for accumulation of tartar, calcification, mineralization of the teeth. Very beautiful. Calculi renalis, ladies and gentlemen. And the last but not the least remedy that I want to tell you is again a rare remedy, but I still want to share with you. You know how much I love rare remedies, and the name of the remedy is Fregeria. Very beautiful remedy. Fregeria. You can see here, removes tartar from the teeth. It is kind of a remedy which comes from the idea of strawberry. And that's why this is a very important remedy in children who, after eating strawberry or any kind of berries, develop urticarial rashes. And the whole body gets swollen up. There is urticaria throughout. And typically, you will also see the tongue gets swollen. There is a kind of angioneurotic edema. Although, in cases of angioneurotic edema, the one remedy which I highly recommend, which I share with you today, which I use a lot in my practice, is the remedy antipyrinum. I want you to study this remedy a little later. This is one of the most important remedies in homeopathy for angioneurotic edemas. And I've used it. You can see edema of the face, edema of the lips. The whole body gets quickly swollen. Antipyrinum 6 potency. There are many remedies, but this is a very beautiful remedy that I want to share with you. Let's go ahead. Let's go ahead. I think in almost close to 1 hour, we have shared so many different remedies, so many different ideas. It's beautiful. And I'm glad that you all are kind of really upgrading yourself. Every time there should be a session, every few hours, every few weeks, you should upgrade. You should feel you're better than you were yesterday. That's the idea. That's life, ladies and gentlemen. Some children, they develop wisdom teeth related issues. The wisdom teeth is removed and there is a lot of pain. There are many remedies for that. There is chamomilla. There is fluoric acid. But the very important remedy which we use is known as cherianthus. Cherianthus, very beautiful remedy. This, let me show you very quickly. Cherianthus. Dekho. Cherianthus. Let's see. Dekho. Deafness, otorrhea, pains on the mouth, nose is stopped at night from irritation of cutting of wisdom tooth, effects of cutting of wisdom tooth. Another remedy, magnesium carb. Another remedy, chamomilla. So interesting. The other and one of the most important thing I want to tell you, the teeth. When I look at the teeth of the child, and I have specially click a picture for you, I want you to see this teeth forever in your life. And when you see this teeth in a case of child and kind of serrations in the teeth, you can see here. When you see such kind of serrations in the teeth, this is a very important indication that the child may require a nosode. This is a very important indication for a nosode in a child. Serrated teeth. And you can see in the repertory, serrated. This is called a serration. It has all the nosodes like syphilinum, like basilinum, like medorinum, like tuberculinum. So almost other than sorinum, all the nosodes are there in serrated teeth. So when I see serrated teeth, I generally already know that the child's immune system is low and requires a nosode. I want you to remember this picture forever, because from today, when you see this kind of teeth, your mind should go towards this rubric, and you should remember that I have seen this teeth before, and this is serrated teeth, and this could require a nosode. Obviously, other symptoms should also match, but this is the keynote. And I've treated hundreds of cases just based on this. I want to tell you, it's such a solid symptom. Sometimes, some children, the teeth are very yellow. And if you see yellow teeth, there are many remedies actually. There is thuja, there is lycopodium. Okay, there is silica, many remedies. But the main remedy which I want to share with you is the remedy basilinum. If you see this, the more yellow the teeth, the more basilinum is indicated, remember. Now, this is not written in a repertory. This is a clinical indication. Basilinum, ladies and gentlemen. But that there is an allopathic medication that is rifampicin. So if a child had tuberculosis and he has taken an anti-tubercular treatment, which may include rifampicin, streptomycin, ethambutol, and etc. Because of that also the teeth can become yellow. So when you see yellowness of the teeth, you also ask the mother, did in the family anyone had tuberculosis? Did the child had tuberculosis, or during the pregnancy you had tuberculosis? This is also important, ladies and gentlemen. So you should know what is common, what is uncommon, and what is maybe due to allopathic medicines. Now I will tell you one more thing. In some cases where the teeth are very yellow and even the dentist is not able to do anything, you can use rifampicin in potentized potency. Okay. Tautopathy, ladies and gentlemen. This is the advanced homeopathy that's now being followed. I put up a picture of the crown and the root. The upper part is the crown, the lower part is the root. Why is this important? Because we have homeopathic remedies for that. If typically the roots are affected, when the dentist says that there is a total very bad root caries and root canal is affected, there is a more important mesarium and thuja. On the other hand, if crown is affected, then the remedy is mercury and staphysagria. So, just by looking at the teeth and the dentist writes, oh, the crown is totally carried, it is mercury and staphysagria. If the root is affected, it's mesarium and thuja. This also gives you a pointer, ladies and gentlemen. This is what I want to share with you. The idea of cleaning all of you for our homeopathic pediatric online certificate course. It has just started. An introductory lecture has just got over. We just did it. But you all can still join. It's a 60-hour online course, certificate course. You will get an access for 1 year. You can watch the recordings again and again. And there are some really remarkable speakers in our course, including Dr. Vijay Vaishnav, Dr. Mayuresh Mahajan, Dr. L.M. Khan, Dr. Praveen Jain, some really phenomenal teachers, and all talking about pediatrics and talking about different topics in pediatrics. The case taking, the behavior, the developmental delay, the allergy, the homeoprophylaxis, the autism, the ADHD, everything together. It's a one of its kind of course, and I genuinely do believe that we are putting a lot of our energies in this course because this is one of its kind. We genuinely want to do something by which we can upgrade the education and also our own selves. So I hope that you all can still join. You can write to us. You have all the details. There is still a discount offer for next few days. Write to us, be a part of us. I hope you liked the lecture before, and I hope you keep liking it again. Thank you.